How's it going, guys? We have a medium difficulty question for Pharm/micro for step one. A pass level vignette. Very easy. But then, how do we treat it? And then, what's the adverse effect of the drug used to treat it? So, a few layers of complexity, overall medium difficulty. The challenge for me regarding this clip here is to stay consolidated because with all these answer choices, we could easily unravel this into a 29-minute discussion, okay? But I'll stay concise. So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram, Mehlman_medical, MEHL_medical. The link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now let's start the clip. 19-year-old dude, 24-hour history of rash. He went camping 3 weeks ago. Physical exam shows a maculopapular rash in the chest, back, palms, and soles. Most appropriate pharmacologic therapy for this patient's condition is most likely to cause which of the following adverse effects. So palms and soles rash, very buzzy, okay, plus camping. This is Rickettsia, Rocky Mountain spotted fever, spread by dermacenter wood tick. Despite the name, it's usually the eastern United States. So palms and soles rash, not just Rocky Mountain spotted fever, Rickettsia, but also secondary syphilis, Treponema pallidum, Coxsackie A virus, hand, foot, mouth disease, in pediatrics, desquamation of the palms and soles in Kawasaki disease, as well as staphylococcal scalded skin syndrome, arsenic poisoning. Okay, so sometimes the rash for Rocky Mountain spotted fever can be wrists and ankles, but it's going to migrate inward toward the trunk. It's called a centripetal rash, okay? And we treat this with doxycycline, okay? A 30S ribosomal subunit inhibitor. So let's just walk through the answer choice here. As I said, I'm going to stay consolidated. I know some of you want lengthy discussion, but I'm going to stay concise. Choice A, acute tubular necrosis, wrong fucking answer. This refers to classically aminoglycosides, all right? Gentamicin, tobramycin, amikacin, very, very high yield. Wrong answer. Choice B, constipation, wrong answer. This is going to be verapamil, a non-dihydropyridine calcium channel blocker, as well as iron tablets, okay? So iron tablets, constipation, as well as black stool. Don't confuse verapamil, the non-dihydropyridine calcium channel blocker causing constipation, with the dihydropyridine calcium channel blockers such as nifedipine and amlodipine, which cause peripheral edema / fluid retention. Very, very high yield, those calcium channel blockers for family medicine in particular for TCK. Choice C, gingival hyperplasia, wrong answer. This is classically cyclosporin, immunosuppressant, as well as verapamil. Now look, we can Google gingival hyperplasia and find a myriad of drugs that can induce this. Doxycycline, not classic. It's not impossible, but it's not classic, okay? Cyclosporin, verapamil. Choice D, interstitial nephropathy, wrong answer, albeit exceedingly high yield. I made many YouTube clips on this. This is going to be an NSAID or beta-lactam or cephalosporin, causing white blood cells, eosinophils in the urine, plus or minus a rash in about 50% of patients, okay? Wrong answer, but high yield. Ototoxicity, wrong answer. This is going to be aminoglycosides. As I mentioned before, they cause acute tubular necrosis, but they can also cause ototoxicity. Ototoxicity can also be loop diuretics. Prior YouTube clip I made was I mentioned ethacrynic acid, a type of loop diuretic, but also furosemide, okay? Ototoxicity. Photosensitivity is our correct answer, okay? So you need to know that the tetracycline antibiotics, doxycycline, can cause blistering, photosensitivity, all right? Now, they might tell you a 23-year-old was treated for a mycoplasma pneumonia, and classically we use azithromycin, a macrolide antibiotic as empiric treatment, but sometimes tetracycline antibiotics can be used for atypicals. So they might say 23-year-old had mycoplasma pneumonia, was treated with an antibiotic, goes out and gets blistering of the lips, the skin. You just need to know that that's photosensitivity from doxycycline, okay? Nothing dramatic. Also, you need to know topical retinoids for acne, like topical tretinoin can cause a rash, photosensitivity. That's very high yield, especially for family medicine. Finally, QT prolongation, wrong answer. This can be caused by a number of agents, but high yield for USMLE, antipsychotics, okay? And also metoclopramide, which is a prokinetic / antiemetic, and also the macrolides, azithromycin, can prolong the QT interval. So a lot we can discuss, all right? But your take home for this short clip is to know the palms and soles rashes, as I mentioned earlier in the clip, as well as that doxycycline, tetracycline antibiotics can cause photosensitivity. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel, and I appreciate your time. That's it.